Greetings and welcome to today's presentation. We are so excited to have all of you here today, but before we can dive into our important presentation on the Medicare-Medicaid Alignment Initiative, commonly referred to as MMAI, we're going to walk through a few logistics. My name is Elena Kennedy. I'm the Chief Operating Officer here at the Illinois Association of Medicaid Health Plans. And we are presenting our presentation in partnership with Age Options and Humana. Once again, before we dive into the presentation though, we are going to pause and walk through the platform a little bit further. Hopefully, all of you can be able to hear me at this point. You can utilize and hear me through the audio function. The audio function can be found on your GoToWebinar control panel, which should be on your right-hand side. You can toggle between your computer or phone audio. However, please note if you want to utilize your computer audio, you might have to give access to the platform on your computer. Once again, you can maneuver between your computer or phone audio throughout the presentation. Continuing down on the control panel, you should find a Questions tab. Via the Questions tab, you can submit a variety of different questions related specifically to the presentation or logistics about the platform or the webinar. Those questions will be directed to myself. I'll be answering a few of those as we move along, but I will also be holding on to a few of those for our question and answer section, which will be at the end of the presentation. Please note we also have a chat function at the bottom of the control panel. This chat function allows you to create community with other attendees, the panelists, or myself. Please note though, due to some firewall protections or the version of GoToWebinar you have, you might not be able to utilize the chat function. We apologize for that inconvenience and appreciate your understanding. However, do not fret. Anything that is submitted by me in the chat function will also be included in our follow-up email. That brings me to one of my last and most important points. We will be sending around a recording of today's presentation to all of our registrants. That means that even if you attended but need to walk away for whatever reason, or if you know a colleague who registered but was not able to attend today, they will still be able to receive a direct link to the recording. Additionally, this will be archived and we will be posting this onto our website. So once again, we will be sending out a recording of today's presentation for you to re-review as well, and we will be archiving this and posting it onto our website under our video library. Should you want to reference any other additional webinars as well, please always check out our video library as there's a lot of fantastic and amazing tools on there. Without further ado though, we are going to take a moment and step away from our logistics and dive into our presentation a little bit further. As noted at the top, my name is Elena Kennedy and I'm the Chief Operating Officer here at the Illinois Association of Medicaid Health Plans. I am joined today by an amazing panel of fantastic and very dedicated individuals within and serve within the Medicare-Medicaid Alignment Initiative. We have today Lisa Wiseman, Cassandra Montgomery, Erin Madej, and Stella Van Deen. Eden, did I pronounce that correct, Stella?
Yes.
Perfect. We've got these amazing panelists who are going to walk through a variety of different topics related to this space. I'm going to pull back and stop speaking though, so we can give them the platform and the floor to speak about the program a little bit further, both from the provider perspective as well as from the health plan perspective. I will continue providing a few other logistics at the end of the presentation, and once again, we will have an opportunity for question and answers afterwards. So with that, I'm going to hand it over to Stella to get us started and talk about this from the provider perspective. Stella, welcome.
Hello and good afternoon. My name is Stella Van Den, and I am an advisory training specialist at Age Options. And we would like to thank IAMHP and Humana for having Age Options here today. Before we go into what the Medicare-Medicaid Alignment Initiative is, I wanted to present a quick overview of what Advisory by Age Options does. Advisory trains professionals on how to help consumers navigate the complexities of Medicare and Medicaid. And we do this by providing training, technical assistance, and materials, through advocacy, and through providing comprehensive counseling to Medicare and Medicaid consumers. So what is the Medicare-Medicaid Alignment Initiative, or MMAI as it's commonly referred to as? MMAI is a voluntary health program for people with both Medicare and Medicaid. It is jointly administered through the Centers of Medicare and Medicaid and the Illinois Department of Healthcare and Family Services. MMAI provides an opportunity to simplify the way that beneficiaries access their healthcare benefits. Without MMAI, dual-eligible beneficiaries are receiving their Medicare and Medicaid benefits separately through Original Medicare and Fee-for-Service Medicaid. This includes Medicare Part A, which covers hospital insurance, such as hospital stays and some home health care. Medicare Part D, which covers medical insurance, such as doctor's visits. Medicare Part D, which is prescription drug coverage, and Medicaid, which can offer some coverage for services that Medicare does not cover, such as dental care and long-term care. Through the MMAI, beneficiaries can receive all of their benefits under one health plan, and they only need to use one card to access their doctors, specialists, and go to their pharmacies, rather than having separate cards depending on which piece of the coverage they are using. Beneficiaries do have to go to providers that are in the MMAI plans network, and we would like to note that MMAI is not a Health Choice Illinois program, rather another managed care program that HFS has, and is not under Health Choice Illinois because under federal guidelines, individuals with Medicare cannot be forced into a managed care program. The purpose of the MMAI program is to address that dual eligibles have significant health and functional support needs. And when the programs do not coordinate, it can lead to fragmented care, high costs, and poor outcomes. Through dual eligible beneficiaries getting their services under one plan, such as MMAI health plan, the costs and services of Medicare and Medicaid are aligned, and it can provide an emphasis on care coordination and improve the quality of the beneficiary's experience in accessing care. As a network provider for an MMAI plan, you will be able to provide care to new and existing Medicare-Medicaid beneficiaries, participate in a simpler reimbursement system that focuses on quality, and have access to a team-based approach to care. To be eligible for MMAI, a beneficiary has to be enrolled in Medicare Part A and Part B and be enrolled in full Medicaid. This means that if a beneficiary is eligible for Medicaid due to spend down, they will not be eligible for MMAI. They must be 21 and older and currently live in one of the counties listed here. However, this will be changing on July 1st when MMAI will begin going statewide. Those who are not eligible for MMAI include those who are enrolled in a Health Choice Illinois MLTSS plan. However, those individuals who are enrolled in an MLTSS plan are eligible for MMAI. They can choose to be enrolled into an MMAI plan. They just cannot be enrolled in both of those plans at once. Those that are only eligible for Medicaid through the breast and cervical cancer program, those receiving third-party insurance, those receiving temporary Medicaid benefits, and those enrolled in health benefits for workers with disabilities program, and beneficiaries who are receiving support through the Developmental Disability Institutional Services and the waiver program for individuals with developmental disabilities. So the MMAI program is a voluntary program. However, it does operate on a passive enrollment that Client Enrollment Services oversees. And when referring to passive enrollment, we mean that the beneficiary can be automatically enrolled into an MMAI plan. Beneficiaries who are eligible will receive an enrollment packet with a plan that is selected for them. Once they receive the packet, they have 60 days before the effective start date to choose a different plan or to opt out of MMAI completely. If no choice is made in those 60 days, Client Enrollment Services will proceed to passively enroll the beneficiary into the MMAI plan listed in the notice. Beneficiaries do have enrollment rights. Eligible beneficiaries can enroll, disenroll, or switch MMAI plans at any time of the year. And this can only be done through calling Client Enrollment Services. If a beneficiary disenrolls, it will be effective the first of the following month that the request was made. And when a beneficiary opts out, they will return to original Medicare, fee-for-service Medicaid, and a standalone prescription drug plan. If the beneficiary is receiving long-term support and services, they will be enrolled into an MLTSS plan. MMAI provides a 180-day transition period for brand new MMAI plan enrollees, where beneficiaries can continue seeing out-of-network providers if they are receiving current ongoing treatment. And there is a 90-day transition period for beneficiaries who are switching MMAI plans. The out-of-network provider must be willing to bill the MMAI plan during the transition period, and MMAI plans may not deny payment to out-of-network providers for continued treatment during this transition period. During the 180-day transition period for new enrollees, MMAI plans must honor coverage non-Part D drugs, therapies, and other services in Medicare and Medicaid at the time of the beneficiary's enrollment into an MMAI plan. And these services cannot be terminated unless there's advance notice to the beneficiary and a transition to other services. Out-of-network providers may be offered a single case agreements to continue care beyond the transition period if they remain outside of the plan's network. So how does the plan that beneficiaries get passively enrolled into get chosen for them? The Illinois Client Enrollment Broker algorithm considers the following to determine the best MMAI plan and primary care provider for a beneficiary if they did not take any action in the 60 days before their effective start date. If a beneficiary is currently enrolled into a Medicare Advantage plan and that parent company has an MMAI plan, they will be transitioned into that MMAI plan. Also, if a beneficiary is enrolled into a Medicare Advantage plan and an MLTSS plan that has the same parent company, which has an MMAI plan, they'll be transitioned into that MMAI plan. The algorithm also takes into consideration the current nursing facility, most recent health plan enrollment, claims history, and geomapping. MMAI health plans must cover all services that Medicare and Medicaid cover that are listed here. We would like to bring attention that MMAI does cover long-term services and supports, which are services provided in the nursing home, a supportive living facility, or in the beneficiary's home through the community care program or Department of Rehabilitative Services. MMAI plans may also cover additional services such as a $0 copay for prescription drugs, coverage for some over-the-counter medications and supplies, coverage for gym memberships or fitness class, or coverage for gift cards. And all these additional services are very depending on the MMAI plan that the beneficiary is enrolled in. An essential service that all MMAI plans provide is care coordination. Enrollees in an MMAI health plan will get a care coordinator that can help establish collaboration and communication among the individual's healthcare providers. Care coordinators help the beneficiary with navigating the healthcare system, such as finding a healthcare provider that is in their plan's network and scheduling appointments. Care coordinators also help with managing chronic conditions, finding resources such as social services, and helping the beneficiary file appeals, which is requesting coverage for services and prescription drugs that are not typically covered by the plan. MMAI does cover long-term supports and services, and beneficiaries who receiving LTSS before they enroll into an MMAI plan are getting coverage for LTSS through a Health Choice Illinois MLTSS plan. And these plans only cover services receiving through a nursing home or a home and community-based served waiver service programs. And these services include long-term care, some Medicaid waiver services, some behavioral health services, and some transportation to medical appointments. And if a beneficiary receives LTSS services and chooses to opt out of MMAI, it is mandatory for them to enroll into an MLTSS plan to receive coverage for their LTSS services. Essentially, managed care is mandatory for the beneficiary for their LTSS services, and if they're eligible for MMAI, they can choose to get that coverage either through their MMAI plan and their MLTSS plan, or an MLTSS plan. MMAI plans are not allowed to charge beneficiaries more than what is charged under Medicare or Medicaid. And some plans do offer a $0 copay for prescription drugs or other services that would have a copay under traditional Medicare and Medicaid coverage. So we do have some considerations that we recommend beneficiaries to think about before deciding to opt out of MMAI or to switch plans or to enroll into MMAI. One is that, are there healthcare providers in the plan's network? Through reports from the beneficiaries that we have seen and that our partners have seen, this tends to be a priority for beneficiaries when considering enrolling into an MMAI plan. And if a beneficiary is willing to change healthcare providers due to enrolling into an MMAI plan, we highly recommend them to take a look at the provider network in general and see how many providers are available to them in their area. Another consideration is, does the plan cover their prescription drugs? And does it require any prior authorization or other restrictions to any of their medications? And lastly, we also recommend that they see if there's any extra benefits that the MMAI plan offers that will be extremely helpful to them. Beneficiaries can get the answers to all of the questions in the previous slide through calling client enrollment services. Again, we like to remind that calling client enrollment services is the only way that the beneficiary can switch MMAI plans, enroll into an MMAI plan, or opt out of MMAI completely. And they can also call client enrollment services to compare plans if they're just trying to decide which plan will be the best for them. Beneficiaries can also speak to a senior health insurance counselor for impartial guidance and information. Now we will begin going into the statewide expansion of MMAI. The history of MMAI in Illinois is that in 2013, Illinois received approval for the Financial Alignment Initiative demonstration to test a model of a program to better serve Medicare and Medicaid enrollees. MMAI was implemented in Illinois in 2014 in 21 counties in the greater Chicago area and central Illinois. And on July 1st, 2021, MMAI will begin expanding statewide. The current timeline of the state expansion is what follows. Eligible beneficiaries in expansion counties, so counties where MMAI is going to be new, can opt into MMAI beginning June 1st for a July 1st effective start date. MMAI's passive enrollment will be done in phases with cohorts. There is not much information about the cohorts currently. as in who will be in the first or cohort or who will be in the second cohort. What we do know is that those beneficiaries enrolled into MLTSS plans will not be in the first or second passive enrollment cohort. The first passive enrollment cohort will be sent materials in June with a September 1st effective start date. So this means that beneficiaries will not be passively enrolled in MMAI in expansion counties until September 1st. However, they do have the option to opt into MMAI to begin receiving services, MMAI services at an earlier date. For updates on the MMAI statewide expansion, we highly recommend going to the HFS website. Beneficiaries in counties where MMAI is currently in will not go through enrollment phases during the expansion, so MMAI will continue to operate as it's currently operating. New counties will have different plans available to them, as well as different enrollment options, depending on how strong the plan's network is in their county. For example, a plan can be available in a certain county for passive enrollment and for beneficiaries to opt into, or the plan can be available in a specific county for opt-in only, or a plan may not be available in a county at all. So, and this a plan's enrollment status across the expansion counties varies, and there's a chart on the HFS website that breaks down what plans are available in new expansion counties and what their enrollment status is. And lastly, we would like to go over the Home Care Ombudsman. The Home Care Ombudsman is a great resource for beneficiaries. It can help MMAI beneficiaries resolve any complaints that they have. And they can contact the HCO if they feel if their rights have been violated or if they need help filing an appeal. And to contact the HCO, beneficiaries can call the Illinois Department on Aging Senior Helpline or by emailing the program. Thank you for your time and sort of listening to our presentation. If you have any question about advisory services, MMAI, Medicare, or Medicaid, please feel free to reach advisory either by phone or by email. And I will be now handing this back over to Elena.
Greetings, and thank you so much, Stella, for that amazing and in-depth presentation. Reminding all of you that we are moving through our IAMHP and Humana, as well as Age Option Presents on the MMAI program and how partnerships benefit the community. As you all saw, we just went through and walked through an MMAI 101 and expansion, and now we're going to hand it over to Lisa, Erin, and Cassandra for a discussion on community partnerships, resolving issues, and then talking points when trying to contract with MMAI plans. With that, I'm going to hand it over to Lisa to get the next portion of today's presentation underway.
Thanks, Elena, and thanks, Stella, for your help today. My name is Lisa Wiseman, and I lead community engagement for MMAI here in Illinois for Humana. For MMAI community engagement, we form partnerships and support community advocacy and provider groups statewide. In addition to supporting current programs, we work with our partners to develop new projects that increase access to health services and ensure continued stable support to our communities and the extremely important work that these groups are doing. The transition into managed care in Illinois has been difficult for both members and those working with members. And as we look towards this expansion statewide, we strive to be present in the community to break down barriers in communication between members, community groups, provider groups, and managed care organizations. Our goal is to decrease confusion and increase faith in the MCO system while providing services in order to best serve our new members. Some of our focuses are chronic disease education, health literacy, and healthcare navigation, working with these community groups to identify gaps and address any concerns or barriers regarding access to healthcare. Could you do the next slide, Elena? Thank you. Our partners serve as subject matter experts in a variety of fields, each with their own focus populations. We do our best to reach as many people as we can while still focusing on the MMAI population. An example you've just seen is bringing in a partner such as Age Options to help us with either provider or community-facing education, as they are experts in their fields. In response to COVID-19, this year's initiatives will continue to look a little bit different than they have in years past. We've been reallocating support in order to serve our partners immediately, assisting with COVID-19 specific programs and education projects, and distributing PPE such as masks to our community groups and providers. I wanted to provide just a few examples of what we've been able to do in the past year, as well as some examples from the past, in hopes of getting a good mixture of both here in the near future. We were able to work with the American Heart Association and the Sweet Potato Patch to provide meals to high-risk individuals in the Inglewood area during the COVID pandemic. We've been supporting the AIDS Foundation of Chicago on their vaccine education and awareness. Those are called COVID Grand Rounds, where experts, community members, and advocates discuss various aspects of COVID-19 and vaccinations. We've been working with Age Options again in caregiver support and outreach training activities through their Caring Together, Living Better program. In the past, we were able to do some fitness programming and adult day service functions with the Chinese American Service League. We have a partnership with Age Smart, which is the area agency on aging down in our St. Louis adjacent counties, to provide masks, home delivered meals that actually had some vaccine education in them, and a virtual senior expo. We're also working with the Northern Illinois Food Bank to do a mobile pantry, and that will be in the Rockford area. Again, these are just a few examples. We work with a lot of great groups. Next slide, please. Although these were a little while ago now, I wanted to include them as I hope to return to more of this kind of work. We were able to work with EverThrive Illinois to provide cooking workshops within several Oak Street Health clinics. And we had a partnership with the American Diabetes Association to provide educational workshops within Oak Street Health clinics again. Some of our topics were knowing your numbers, exercise, and introducing physical activity, and a healthy lunch day, promoting healthy eating and cooking demonstrations. Next slide, please. Here's an example of a great project we formed while needing to be fully virtual. We've again teamed up with the ADA of Illinois and are providing a quarterly resource and wellness series this year. The entire series will be virtual and free to the community. Our second resource and wellness series collaboration will be on Wednesday, June 2nd. For anyone interested, the topic will be controlling A1C, and here's more information on this slide. Feel free to share. Before I hand it over to Erin, I just wanted to say that I'm in the process of connecting with more community groups in the expansion area and still learning how to best build those relationships and best serve our new regions. If you're interested in learning more or are a community group that would like to introduce yourself or think that I need to be on any email list, I'll provide my email to Elena and feel free to reach out. Thank you. Go ahead, Erin.
Hello, my name's Erin Madej. I work in provider relations for Humana and the MMAI product in Illinois. Elena, can you do the next slide? Okay, thank you. So for all providers that participate with MMAI, HFS has created the Managed Care Provider Resolution Portal. The Resolution Portal serves as an outlet for providers with unresolved issues. The goal of this portal is to encourage communication between the MCO and the provider to ensure a fair resolution of disputes. Next slide, please. So all of the providers will need to assign an agent to set up an account and register in order to submit a dispute. And to register, I've provided the link right here, which you can also find on HFS. All you have to do is enter your email, choose a username and password, and click register. It could take up to 48 hours to be confirmed. If you do have any questions about registration, please send them to hfs.portalinquiries.gov. And on the HFS website, there's also a portal overview and tutorial documents that are really helpful. Next slide, please. So we do ask before you go and submit your dispute to the portal to try and work with your MCO first. It's actually required. When you're working with the MCO, please make sure to get a tracking number. If you just can't seem to get any resolution, that's when we ask that you use the portal for resolution, and the state will help. Next slide. And then I just provided each MCO provider dispute process because each one is different. So you'll want to go on their websites. This is all available on HFS as well. Get their information on how to submit a complaint and try and work with them. Get your tracking number and hopefully get it resolved that way. And that's it. Hand it over to Cassandra.
Hello, everyone. My name is Cassandra Montgomery, and I am a contracting executive with Humana. And I'm going to be speaking to you guys today a little bit about contracting with providers for MMAI. Enrollment with the Illinois Department of Healthcare and Family Services is required. Providers must have a valid or active Medicaid Illinois ID in order to become a participating provider with the MMAI plan. And I emphasize Illinois because some providers may have valid Medicaid IDs in states that border Illinois. Those ID numbers are not recognized. You must have a valid Illinois Medicaid ID. If you do not have a valid Medicaid ID, you can enroll using HFS's impact system. And I've provided a link to the enrollment page. I encourage you to begin the registration process as soon as possible. I hear that it can take a few months to receive an ID number, and unfortunately, you cannot become a participating provider without that Medicaid ID number. The impact site is a great resource. It also contains a link to frequently asked questions and any other information you may need or questions you may have. So I encourage you to browse the site. I've provided the web address for the enrollment page as well as the email and a phone number. After you have obtained your Illinois Medicaid ID number, you can then contract directly with MCOs that are participating in the MMAI program. Next slide. And I have provided the provider services contact information for the different participating health plans. And for Humana, of course, if you have any questions, feel free to reach out for my direct information. If I am not the contractor for you, I will put you in touch with the contractor who can assist you. And that concludes the Humana presentation.
With that, I just want to pause and say thank you so much to all of our panelists today for providing not only their time, but their expertise with all of us. I think that this participation and presentation is just going to help further a seamless transition into this program. And we also wanted to pause and just show appreciation to all of our attendees who took an hour out of their day on a Friday all day. For those of you who are watching this live, to see and learn and share space and community with Humana Age Options, as well as IAMHP, the Illinois Association of Medicaid Health Plans. Diving into questions, I have a few that I can answer at the top before transitioning into asking questions to our panelists. I would like to note, should you have any questions, feel free to submit those via the questions tab on the control panel. First and foremost, yes, today's presentation will be circulated to all of our registrants here, both attending right now and including those who were not able to attend but did register. Additionally, we will be also archiving this presentation and placing it on our website. If you are not familiar with our website, please visit imhip.net. That is IAMHP.net. By clicking on our video library on our Insights page, you will be able to access all of our archive videos, not only this one. Additionally, IAMHP will be hosting a slew of other MMAI LTC billing specific webinars that will be taking place through May all the way into October. We have had a variety of you already sign up for that, and we are so excited, but feel free to continue registering for those. Please note that those webinars are not part of a series per se, but are very similar to each other. But I note that we need to hear some things more than once, and so it's always great to attend a variety and multiple of those. Additionally, you don't know what questions might be received from the community, and it's always great to hear. Additionally, yes, when I send out the email, I'll make sure to include the Humana presenter's contact information so that you can communicate and follow up with them afterwards. Also, yes, we will make sure that I will get you Lisa's contact information specifically in case you are considering or want to have discussions about community partnerships. I know Humana, as well as all of the health plans, are doing fantastic work around community engagements. Additionally, yes, we do have other webinars talking about community engagement from the perspective of the health plans. Please visit our video library where we have, for example, a webinar with Molina that talks about how they have utilized community partnerships to engage and address social determinants of health, as well as address items that were a result of the social unrest. We also have webinars on there from Blue Cross Blue Shield and their partnerships with diabetes, County Care and their partnerships and how they are tackling diabetes, vaccinations as well, Molina and the partnerships and how they're utilizing that to address maternal health. Aetna has ones about their partnerships addressing children's mental health and mental health services in general. So I highly encourage you check those out for all of our community engagement needs. All right, this question is directed towards Stella, but I also encourage, should anyone have any question, the Humana team, if you would like. Stella, what is the difference between LTSS and MLTSS again? And can you go back to the slide discussing the difference between MMAI and MLTSS? With that, Stella, I'm going to hand you back the screen sharing so you can show that slide. Or actually, I will share that while you talk.
Yes, so LTSS are long-term support services, and those services include coverage for long-term care, Medicaid waiver services, some coverage for some behavioral health services and coverage for some transportation to medical appointments. And for long-term support services, beneficiaries who require those long-term support services can receive coverage for them through a Health Choice Illinois MLTSS plan. And they cover those services if you are in a nursing home or receiving services from a home and community-based waiver program. And MLTSS, that's the only plan, they only cover the long-term support services. So if you beneficiary has Medicare and Medicaid and an MLTSS plan, the MLTSS plan will only cover the long-term support services and services that I described earlier, and then Medicare and Medicaid will cover the services that it usually covers, such as Medicare Part A or Medicare Part D. And then the difference between an MMAI plan and an MLTSS plan is that MMAI, the beneficiary can get in an MMAI plan, the beneficiary can get coverage for their Medicare services, Medicaid services, and their LTSS services. And meanwhile, in an MLTSS plan, they only receive coverage for their LTSS services. And additionally, they must choose either an MMAI or an MLTSS plan to receive coverage for their long-term support services. So they cannot beneficiaries cannot opt out of managed care for their long-term supports and services.
Fantastic. Thank you so much, Stella. I think that clarified. I got some positive feedback from those who are attending today. Additionally, I have received a few different questions. Great point. Yes, during the Humana presentation, there were some amazing links that were included in that. When we send out an email copy of the recording, I will also include a PowerPoint slide deck of this so that you can click on those links and so that you don't have to write them down. So once again, I will be including the links and the wonderful links that were provided to you so that you can access that. Stella, I'm receiving a few questions from individuals who just wanted to further clarify the beginning of your presentation and how it merges the Medicare and Medicaid program. Can you review the slide just a little bit further again? Because we've received a few different questions about it, just in its totality.
Yes, so as if a beneficiary is in a county that does not have MMAI available to them, they are receiving their Medicare and Medicaid services separately, which means that they could have up to 3 different health cards for their services. They'll have their Medicare card, which is the red, white, and blue card. They'll have their Medicare Part D card, which is for the prescription drug coverage. And then they'll have their Health Choice Illinois Medicaid card. And what MMAI does, it essentially provides coverage for all of those services through a health plan. So then they will receive one card for all of their services. And as well as when they're enrolled into an MMAI plan, they are only able to see providers that are in an MMAI plan network. So they have to make sure, meanwhile, if they're not enrolled in an MMAI plan with Medicare, they can go to any provider that accepts Medicare. And now they will have to go to the providers that are in the MMAI plans network and accept their MMAI plan. But they can change MMAI plans at any time or opt out of this program and go back to receiving their Medicare, Medicaid services separately if it works best for them.
Perfect. Thank you so much, Stella. The next question is, we know there is a high volume of providers trying to contract with the health plans. Is there been some delay contracting with the health plans, or has there been some delay and impact? So Cassandra, I can kickstart that one off a little bit more high level, and then do you want to speak a little bit further from the Humana perspective on that one?
Sure.
Splendid. So yes, there has been in some situations a high volume of providers across the state who are working diligently and wonderfully with our health plans, all of our health plans. But because of that, in some ways, yes, there has been an onslaught of that. We request your patience as we continue to work through all of that. And you have our commitment from the health plans to continue working with all of our providers to ensure a seamless transition. That being said, though, there are variations of what that looks like and might feel like between the health plans. And from that perspective, I will hand it over to Cassandra to provide additional color from the Humana specific perspective.
Yeah, so from a Humana perspective, there are no delays with contracting. Typically, a contract, once we're done with the negotiation process, it typically takes approximately 30 days for you to become loaded in our systems and shown as a network provider. So in general, there are no delays for Humana.
Wonderful. And if a provider is looking to contract with Humana specifically, Cassandra, are you the right person for them to reach out to?
Yes, they can reach out to me. There's several contractors with Humana that contract in different areas. So if I am not the contractor to help, I can definitely put you in touch with the correct contractor.
Splendid. My next question is going to be directed again to Stella. Stella, you had made a comment about beneficiaries being able to change their health plans. It was my understanding that beneficiaries can change, pardon me, speaking from the perspective of the provider, my understanding that they can change every 30 days. Is that still correct? I'll move, Stella, while you're answering that, I'll move to that slide.
Yes, they can change once a month, and they can change their MMAI plan at any point of the year. You know, this is sort of different than what beneficiaries may be used to, such as with Medicare, there's open enrollment where they are limited to a set time to change their prescription drug plans. But with MMAI, you can change at any point of the year and once a month as well.
Perfect. Lisa, the next question is directed towards you. Sounds like there are a lot of amazing partnerships happening between the community and Humana. Are there specific partnerships that Humana is looking to target throughout the remainder of the year? And is there a way for me to get Lisa's contact information? With regards to the last portion, yes, don't worry. I will be getting Lisa's contact information out to all of you today.
Yes, thank you. I'm still, like I said, working on how to best tackle statewide. I am focused a little bit on where we perceive the most dual eligibles to be, which off the top of my head, the areas are like Northern Rockford area, St. Louis adjacent counties, and central, such as Peoria. I don't have anything crazy specific in mind, but keep in mind that we really want to be able to focus on those that could potentially be MMAI eligible, so that high-risk population of high age, low income, as long as it can benefit them. I really like to stay focused on that. Another focus that we like to have a lot of the time is food insecurity and food deserts. That comes from a little bit higher up Humana corporate goal of addressing those. Other than that, any social determinants of health, though, I am open to really trying to come at this from the wellness perspective.
Wonderful. So with that regard, Lisa, if there are community groups that might have ideas for partnership, who are across the state, would it be safe to say to reach out to you and discuss their ideas and so that you can further explore what those partnerships across the state might look like, given that they are boots on the ground within those communities?
Absolutely. I want to be able to network with everybody to learn as much about these communities as I can, in addition to community projects as well.
And I would say that not across the board, all of our health plans are looking really to continue those partnerships and those collaborations across the state, especially with our community groups and community partners who really know the community. I think that we recently had a discussion on our Sam Says podcast with some of our health plans who were talking about that even further. And so really just want to emphasize, should you be across the state and have a specialized area within that community, please do reach out to individuals like Lisa and across all of the health plans. With that being said, yes, with that being said, Erin, the next questions to you. You had talked about the Provider Monday meetings and reaching out, and there are some individuals who have talked about maybe some billing issues. With that, can they reach out to you with those billing issues? And do you have any other recommendations about how providers can get those items addressed with you, specifically at Humana?
Yes, they can definitely reach out to me. What I've been experiencing a lot lately is when I do go back to the claims team, they ask me for reference numbers as well. So I would ask that you follow the Humana complaint process first, try and call in, get the number, your reference number, so then I have a reference to go back and then they can look into that. And if you're still not getting any resolution, then go to the state website.
Great. And then we had one that was specifically very interesting to me. We had one provider who noted that they've been trying to access the Humana portal, but it says they need 2 EOPs in order to get access. They've just started billing, and haven't received any EOPs. Is there any way for them to get access to the portal without EOPs? And have you heard of this issue in the past?
Yes, we have. If you send me 2 valid members right now with your group, I can have my team bypass that and they'll get you loaded into the system. So just email me.
The next question is, I'm a home health provider and would like to contract with Humana. Is Humana looking to contract with home health providers, or at this time are they no longer looking to contract? That's directed towards Cassandra.
Yes, the Humana network is open. So if you are looking to contract, yes, feel free to reach out and I will connect you with the home health contractor.
Perfect. So once again, I will be sending around. I know there were a few of you actually who sent that question, so I will send over. I'm trying my best to send Cassandra's email to you right now if you ask it, but I will also be sending that to you. With regards to the Monday provider meetings, great question. If you are associated with a trade association, we encourage you to reach out to your trade association. We have many different and wonderful trade associations who we've been partnering with and working actively to get solutions and items fixed. Please note that the Monday meetings are a space where providers are to convene collectively after we've worked through our traditional channels. Please work with your provider relations team member first, work through the escalations. You can also direct those through the portal, as Erin had noted, but should you need additional assistance, you can always reach out and participate in the Monday meetings. I will also note that IAMHP is here. We, in many cases, Erin knows specifically, if we come across an issue, and we will circulate that and forward that along to the appropriate individuals at the individual health plans, not just Humana. So should you have any questions or need something escalated, you can always reach out to myself. I've been forwarding along my email to many of you who've asked. Additionally, if you are not associated with a trade association and would like to attend a Monday meeting, you can also reach out to me and I will connect you back to the HFS team so that you can attend to those. But there are, and don't fret, there are a variety of different ways to have your questions and issues addressed between the already existing channels. As noted, your provider relations, there's escalation guides, also with all the health plans. You can contact me. Once again, there's the HFS portal, and we also have the Monday meetings as noted as well. Great question. Quick and to everyone, does the MMAI program include patients who are in a Medicare Advantage plan?
Yes, if they have Medicare and Medicaid, they are eligible for an MMAI health plan. But if they are in a Medicare Advantage plan and they just have Medicare, they will not be able to enroll into an MMAI health plan.
Great, thank you so much. Stella, from a provider perspective, what was something that you found helpful when working with the payers, and what things should different providers be thinking about when partnering or contracting with a MMAI program?
I would say what providers should think about is essentially their beneficiaries, and if they have if their patients and the people that they are seeing are going to be eligible for the MMAI program, it may be beneficial to help with contracting with them. And then also just essentially just thinking what the best ways to serve the beneficiaries, and beneficiaries can always change plans, the MMAI plans, so as well as just being part of a health program that can help serve beneficiaries and as well. And the ombudsman can help with questions for the beneficiaries and any issues that beneficiaries and providers have.
Thank you, that was really helpful. I'm going to pause and say thank you once again to all of our amazing panelists. We've received such positive feedback from all of our attendees here today. And I want to also pause and say thank you to all of our attendees once again for taking this important hour out of your day to learn more about the MMA program and the partnerships within the community. There were a variety of questions that we were not able to get to today, and we will do our best to follow up with you after the fact. Once again, we will be circulating around a recording of today's presentation later next week, as well as the slide deck. I also want to say thank you to all of our providers and community advocates who attended today. The work you do day in and day out is so vital and so important. And we know that there can be confusion as new programs roll out. We want to make this process easy and a seamless transition for all of you. You can always reach out to us here at IAMHP or any of the health plans. I want to remind you that on our website, we have a list of key contacts there, and you can always reach out to those health plans. For example, I know that Erin's information and a variety of different individuals, including Lisa's information, is on our website, but that also extends to all of our health plans as well and the MMAI program. So please reference our website for key contacts and information, but you can always reach out to the IAMHP team. You aren't alone in this process, and we're happy to help as best we can. And I encourage you to sign up for other billing webinars about the MMAI program to learn more. We will also be doing a podcast episode later in the summer so you can get more information. We appreciate that. all you do and appreciate everything that our panelists do as well. So with that, we are going to end today's presentation, and we look forward to talking to you all in the future. Have a good one, stay safe, and stay well. Goodbye.